Hi all. Today I will try to share my experiences about agarose gel, Algeness nose and temple injections. You all know what is agarose gel and what is Algeness. As you know, it's 100% the first biodegradable injectable implant in the market. So we all know what is Algeness. So I will just tell you some tricks about nose and temple injections. Not too much detail. I will not bore you today, and just want to summarize what is the Algeness benefits. You know it has immediate results. It's long-lasting filler. We have never seen any granulomatous activity with this filler, no granuloma, because inside the filler there is no chemical and no protein, so non-allergenic, and has excellent tolerability. It has minimal irritation, 100% biodegradable. This is very important because there is no residue, and it has extremely low migration. This is very good for nose, for temples, for cheeks, and it gives excellent shape, and it has very good G prime. It has a really fantastic viscosity and plasticity, very easy to inject, and it gives very good contouring and projection. And it's not hydrophilic, so you can see the results immediately. What you see is what you get. It has a very good 3D reticular structure, and as you see here, it's like a sponge, and we call this as a scaffold. It acts as a scaffold, so if you repeat injections, you can see some permanent results, and you can see the activation of fibroblasts and collagen. And here, as you see, it gives three-dimensional support to tissues. So it elevates, it shapes, it gives contour and projection. The injection technique, as all you know, is very simple. Linear retrograde retrotracing technique. Why we do use this technique in so many areas in face? Because we don't want to have a lump. All you can get any complication is lump. So how can we get a lump with this filler? If you inject very big bolus, so it has no migration, you can have a lump. If you do a good injection technique, if you use a good injection technique, and if you disperse the product in the soft tissues, you have never you never see any lump or any problem. So we use generally linear retrotracing technique in soft tissues, but in temple, I will talk you later, it is the only area that you can use big bolus, because it's a fossa and you feel the fossa, so you can use in temple very big bolus. And also on the bone surface in the supraperiosteal plane, you can use very small amount of droplets, 0.1 or 0.2 maximum small boluses. I will tell you later. Before the procedure, as general considerations, all you know, you have to inform patients about limitations and risks. The expectation of the patient should be realistic. 1 ml means 1 ml, not 2 ml or not 3 ml. So the expectations should be very realistic. Avoid body dysmorphic patients. Make an agreed plan and always take before photos, before application. And obtain signed informed consent. This is very important. Okay, as we talk, the expectation should be realistic. We have to talk about the degradation time and the product's persistence. This is the degradation chart of Algeness. The degradation of Algeness is very linear. From the beginning here, 1.4, and 3.5% Algeness agarose eliminates in 15 months. It degrades in 15 months. But in the 8th month, you see that it is already come to 1 ml. So if you inject 1.4 ml, you can say that 7 months later it will be 1 ml. So it's not disappear suddenly. It just degrades linearly. We have to know this, and we have to explain this to our patients. Okay, let's talk about nose and nose injections and non-surgical rhinoplasty. There is 2 different types of injection in nose in non-surgical rhinoplasty. One is to correct and camouflage the deformities like this. And we just want to camouflage to hump, so we inject into the radix and we inject into the supratip, and for tip elevation we inject to the columella. Okay, and the second type is the whole dorsal to total or dorsal augmentation, and we just do this technique in Asian patients, and also to camouflage the rhinoplasty complications. And these 2 techniques, we can use cannula or we can use needle. I will tell you where we have to use cannula and where is needle is more helpful. But before injection technique, we have to know the anatomy. As you see, this is columellar arteries, columellar branch of superior labial artery. It arises from superior labial artery. Here you can see these are columellar branches. You have to be careful when you inject in this area. You have to be very deep. And here, this is the facial artery and lateral nasal artery. Here in the groove, it arises from the facial artery. And this is the dorsal nasal artery. It arises from ophthalmic artery. It connects to the ophthalmic artery, so you have to be very careful. In hyaluronic acid, we see so many blindness when they inject in this artery. And this is very classic, there is too many anastomosis, arteriovenous anastomosis between these vessels in this area. As you see here in the mid-level, it is relatively safe. The lateral area is more dangerous, but mid-level is relatively safe. But again, here there is a connection and there is an anastomosis. So even here, even in midline, there is some points, risky points. Okay, so where we have to inject, as you see, we will stay in midline, and we will do subsumous injection. We have to do very deep injection, periperiostal and periperichondrial layers. We have to be very deep in subsumous area. I will show you where is it. And we need to avoid alar side wall. As I told you here, this is the alar side wall, the lateral area. Don't inject this area. And now, what about the depth of the arteries? The depth of the dorsal nasal arteries and the branch, their branch. As you see here and here, this is the dorsum of the nose, and this is the artery. In the upper nose, this artery locates very superficial. In the upper nose, again, this artery is very superficial. Where is it? It is in the superficial fatty layer. This is superficial fatty layer, and this is the skin. And in the upper nose, the artery is here, very superficial. You have to be very careful. In the lower nose, it is between the deep fat layer and the fibromuscular layer, between them. here. So in the tip of the nose, it is in the deep level, in the upper part of the nose, in the radix, it is in the superficial layer. So you have to be careful, and you have to know the depth, also the depth of the arteries for 3D, to understand it as a 3D dimensional manner. This is columellar artery, and where you have to inject here in the columellar, for the columellar augmentation, for the tip elevation, you should insert your cannula between the medial crus of the lateral alar cartilage. This is lateral alar cartilage of the medial crus. This is the, and you have to insert your cannula to the between these medial crus, not superficial, because you see the columellar branch of the superior labial artery. So you have to be very, very superficial. This is impossible. So you have to be very deep here, and you have to touch with your cannula to the nasal spine. I will now show you. This is the right place to inject, and this is the dangerous location to inject. Okay, this is the alar wing. Okay, this is the alar wing, and this is the pathologic slide, and you can see 3 arteries here. This is the cartilage, alar cartilage, and here you can see the oblique alar arteries, and here you can see the marginal alar arteries. So if you want to inject to the alar wing, you have to be very careful. I don't recommend you to inject in this area in nose. If we want to inject, in my practice, I just follow the cartilage and just on the perichondrium, and then with cannula, and then aspirate and inject. But it is a very dangerous place. So this is really an expert injection technique. So I don't recommend you to inject this area. And I want to show you where is the safest area. The safest area, as I told before, the subsmas level. Subsmas, what do I mean with subsmas? It means that supraperiostal and supraperichondrial plane. When you touch to the bone, or when you touch to the cartilage, it means that you are on the cartilage and bones. So this place is a relatively safe place. Okay, and this is from one of my operation, rhinoplasty operation, and this plane is subsmas. Okay, and this plane is supraperiostal and supraperichondrial plane. So this plane is, as you see, avascular. There is no arteries, and there is no veins, and avascular plane. So you can easily inject big amounts of filler into this plane, but it's not easy, of course. And this is radix, and so many times we need only radix injections. How can you do radix injections? With cannula from tip, you can do it if it is not too deep. If it is too deep, like here, you have to inject with cannula, but from the maybe the midpoint of the dorsum, not from the tip. It is difficult if you insert your cannula from tip. So sometimes you have to insert your cannula from the midpoint of the nasal dorsum. Here you can see, if you insert your tip, you can inject not supraperiostally, but over the muscles, over the SMAS level. So it is a little bit more dangerous. You have to inject just the supraperiostal plane. This is the insertion of the whole dorsal augmentation cases. This is the insertion point for radix fillers. But if you want to do it with cannula, if you want to do it with needle, you can just introduce your needle like this in perpendicular way, touch the bone and aspirate and do your injection. And this is one of the safest technique with small droplets. Not one time, but 0.2, 0.2, 0.2, or 0.1 each droplets. The one of the safest injection technique in radix. And so many doctors prefer this technique. For the columella, as I said, you introduce your cannula from here, or you introduce your needle from here. But in both ways, you have to touch with your cannula or needle to the anterior nasal spine. When you touch the nasal spine, you aspirate and then you inject. This is the safest technique to do your injection into the tip elevation into the columella. You have to feel just over the bone, okay? Never inject subdermal plane here, never. Okay, this is just a case. This is a rhinoplasty patient, very, very thin skin, and she wants to camouflage of the irregularities of the nasal dorsum. We do just a small anesthesia here, but as you see, there is too many dense scars. So what we do with cannula. This is a rigid cannula, and it's better to use 22 gauge rigid cannula because you want to see where is your cannula under the skin. So it is very important to use rigid cannula. Then you start to dissect the scars. Before dissection, if you inject your filler, it can migrate to lateral side. So first you have to dissect the scars, and then you can start your injection with linear retrotracing way. Normally, generally we use 2.5 or 3.5 for nose, but here I am using 1.5. Why? Because very, very thin skin, and 1.5 is ideal for this kind of very thin skin. If the skin is thick, you can use 2.5, even 3.5. And always press with your fingers to the lateral wall to prevent from migration to laterally. Okay, just push with your 2 fingers to the lateral side nasal walls, so it will not migrate to laterally. And each time you just do massage and mold. When you finish your injection, just take time to do massage and molding. And this patient needs, of course, the tip elevation. It's not enough to do camouflage, but she says, okay, it's okay for me to do a dorsal camouflage. So we did it. And when we finish the injection, we just do massage and mold, and we have to see that there is no migration to the lateral side. Okay, if there's any migration, we can do massage to the opposite side and mold it. And then when we finish the injection, I always tape the nose for 1 night. The day after, she can remove it, but the day we inject the nasal fillers, it's better to tape them. It prevents from swelling, it prevents from migration. Yes, the migration is really difficult in Algeness, but in any case, the patient will go to sleep and can create a pressure if she is not sleep the head away. So we just tape it. It's not difficult. Just 1 day. The day after, she can remove all the tapes and see the result. Okay, this patient, we didn't do any anesthesia, only the lidocaine to the entry point, but we didn't do any anesthesia to the dorsum of the nose. From this video, it's still difficult to understand what we did, but normally here there were too many depressions and irregularities. From here, you can see some irregularities here with cartilage and the bony area here. And we did a camouflage, a good camouflage in that area. Okay, the second technique, as I told you, it's small micro droplets, small, let's say, small boluses, 20 gauge needle, touch the bone, aspirate, and give a little Algeness. What I give here is 0.2 ml, and just touch the bone and aspirate and give 0.1 or 0.2 and just check. If you need a little bit more, you can inject radix a little bit more, but always try to do not overcorrection. Never do overcorrection. If you need, you can follow up patient 2 weeks later or 3 weeks later. You can do touch up. For now, for this patient, I think it's okay. As you know, this is what you see, what you get. You see the result immediately. And this is this patient probably no need to repeat of injection, and this is okay for this patient. And a few results with 2.5 with cannula. We introduce our cannula from here, inject the radix and the supratip, and just mold it and do a massage and mold it. And after rhinoplasty, there is a problem in the radix, so we just correct to the radix injection with 2.5. And here a crooked nose, a broken nose. She doesn't want an operation, so we try to correct it with 2.5 Algeness injection in this left nasal wall, and we camouflage the crooked nose. And here there is a deviation to the right side, and we think that if we inject to the left side a little bit Algeness, the result is much more better to camouflage the deviation. And this is the result after injection. And here, Dr. Arnaz's case, a good radix injection to the upper part of the nose injection, 2.5 concentration, 1.2 ml. Here in an Asian patient, this is only total augmentation. So we introduce cannula from here and go to the radix and do linear retrotracing technique, just retrograde injection and molding, that's all, with 22 gauge cannula. And this is 7 months later. The filler is still there. And also in nose, we can use this filler as functional corrections. There is an other depression here. We just do from inside to the nasal valve. We inject to the nasal valve to increase the nasal valve angle, interior nasal valve angle, and she can breathe much more better after this injection, both aesthetically and functionally. We just do correction. This is, of course, dangerous techniques if you don't experience in these areas. But I just want to show you that we can use this filler everywhere. Why? Because it's full natural. It's like your own cartilage, own bone. No reaction. You can use this filler the bone surfaces, cartilage surfaces in every area. Just you have to know the injection technique. Okay, for nose, let's talk about the injection protocol. What is the volume? The volume varies depending on the size of the area. If it's a big man and big nose, you can inject 1.4, okay, but we avoid to inject more than 1 ml in one session. You need to do it in 2 sessions or more, but 1 ml is okay. The maximum amount is 1 ml. And the concentration varies depending on the skin quality and the thickness. If the thickness is good, you can inject 3.5. And you have to choose right concentration with the right skin and the right patient. And if you want to do touch-up and correction, wait 4 weeks, and 4 weeks later you can do your touch-up and corrections in nose. And you have to be very careful in rhinoplasty patients and traumatized and devascularized noses. So if there is any operation before your injection, you have to be very careful. You have to dissect and you have to use more safe techniques as cannula. And if there is dense scarring, you may first dissect with your cannula and then inject your filler. Okay, and you, as I show you, you can compress the proximal ophthalmic anastomosing vessels with your non-dominant fingers, and you have to inject as much as deep plane, supraperiochondrial and supraperiorsal plane. It's subsumus plane. Stay at midline. Don't go laterally. Stay at midline, and use 22 gauge blunt tube and rigid cannula. Aspirate before injection. Each time inject small amounts and inject slowly, and in retrograde injection or small bolus technique. And for the columella and the tip, you have to be careful. Of course, you have to be careful in the radix, but tip and columella, too many problems with HA fillers, as you know. So you have to be careful in this area, and watch for skin blanching if there is any pain, and localized or distant pain, both during or after injection. You may suggest there is a vascular compromise. But I have in this point, I have to say that we have never experienced a vascular problem with Algeness. We did a study in Turkey, an animal study in rats. We inject just into the artery, the Algeness, into the artery, but there were no vascular compromise. And we are doing more advanced study about this. It is really difficult to have vascular complication with Algeness. We have never seen. But even this advantage, we have to. It's better to take care not to inject into the vascular structures. Okay, the second area is temple. In order to meet the best filler in the market to the temple injections, for the temple injections is Algeness. Why? Because there is no migration, because it has very good projection and G prime. So the best filler to fill this fossa is, in my opinion, is Algeness. Before injection, we have to know vascular pattern. There is no only one vascular pattern, different ways. There is different locations of arteries. And in Asian patients, it may be different. In European patients, it may be different. So you have to know that there is different vascular patterns. You have to be careful in each injection. You see, this is the frontal branch of superficial temporal artery. This one. You have to be careful. Just below this. This is the mid-temporal artery and the zygomatic orbital artery branch. So you have to know these two arteries. One is this, and the second one is this and this. So we inject. Where we inject here between these two arteries. Okay, here, this is the entry point. This is an Asian patient, but there is a vascular compromise here. What is the problem? The problem is not the location. The problem is the pattern and the level and the depth of the injection. How? I will now tell you how. This is the superficial temporal artery, and we inject here. But if the pattern is a little bit lower here, and if you inject to the mid-level here, then you inject to the superficial temporal artery or vein here. These are the layers of the temporal anatomy and the temporal area: the skin, the subcutaneous tissue, the superficial temporal artery and vein, and this is deep temporal artery. We always inject supraperiosteally here. If you inject supraperiosteally, there is no problem such as this. Even if you are supraperiosteally, of course, this is not zero risk, but one of the safest plane is superficial injection or very deep injection. Okay, this is the superficial temporal artery, and this is the temporal vein. So what happened in this patient? This is an Asian patient, and this is an HA filler, agarose gel. They inject into the superficial temporal artery. And why they do this? They didn't touch the bone. They inject into the mid-level. Okay, so this level, this depth is really dangerous. So what can we do? And this is the suggested injection zone here, from the eyebrow 1 centimeter up and 1 centimeter to the laterally. This is the temporal fusion line. First, you just see the temporal fusion line. Sometimes it's a little bit more medially, but with your finger, you can just easily find this injection zone. And this is middle temporal vein. With your finger, you can see here the middle temporal vein. It is 1 centimeter above the zygomatic arc. So we never inject here, so don't worry about this middle temporal vein. But we have to be careful about the superficial temporal artery and its patterns. And so, okay, 1 centimeter up from the brow and 1 centimeter laterally, we just find the injection zone, and you can just feel with your finger. Don't go don't inject too lower from this point, because it goes directly just beneath the zygomatic area. You have to be very careful not to inject in the lower part of this area. Okay, we avoid injection to the superficial temporal artery and middle temporal vein. And supraperiosteal injection, we do supraperiosteal. We touch this area with our needle, 27 gauge needle, and then aspirate, and then one shot big bolus. The only big bolus with agarose gel and Algeness is here in temple. The indicated product is 2.5 or 3.5. I always use 3.5. Needle is 27 gauge. The amount is 0.7. The half shrink each side, or one shrink, 1.4 ml to each side. Generally, I use 1.4 ml for each side. Okay. And the injection technique, we just watch arteries and aspirate before injection. And we make digital press on hairline to stay in the fossa. I will show you with video, and do slow, very slow injection. Don't inject fast, very slow injection, and very gentle massage. And warn your patients, there may be a pain for a few days, especially during mastication. So if you warn your patients, there is no problem. If they have this pain, they can use paracetamol for a few days, okay? And this is a video. And as you see, the temporal fusion line is a little bit above, but we have to inject here because the fossa is here. We don't want to go too up to this point. Okay, 1 centimeter up and 1 centimeter laterally to this point, especially for permanent makeup. You have to be careful with the permanent makeup because sometimes it can be tricky and you can just localize in wrong area. Okay, we do pressure with our finger to the hairline. We touch the bone and then aspirate. And after aspirate, we just inject slowly. There is no pain here in temple. We don't need any anesthesia here. And slowly, I use 1.4 ml here. And with lidocaine, 0.2 ml lidocaine inside, okay? And then do very gentle massage. This is really easy to inject in technique. It's very simple technique, but even if it is simple and very easy technique, it's not 100% safe. You have to be careful, always, okay? If you inject very deep, there is not too much irregularities here. Because of your massage, there is some increase in the size of these veins. Don't worry. This is because of the massage. You see very natural result and no irregularities. And this is one of the case of one depot. And here there is a really big fossa, and we feel this fossa here, and this is after injection, a very natural result. No irregularities, no swelling, very natural result with Algeness. We inject 1.4 ml, 3.5 concentration to each side. Okay, for all Algeness injections, and in my opinion, for all kind of injections, even if you inject HA, you need to work in asepsis conditions. If you have any contamination, this will be a problem. Any contamination, this will create a very big problem, even 2 years later. So there may be a biofilm. We never see any granuloma. We never see any biofilm with Algeness. It is impossible because there is no bacterial impurities inside. There is no protein. There is no chemical inside. But if there is a contamination, there may be infection. So this is not because of the material. This is because of our improper technique. So just clean the injection site with antibacterial solution. The asepsis is really essential because we do also massage with our gloves. So we have to work in asepsis conditions. I use sterile gloves, but you may not, you can just use sterile gauzes and do massage with sterile gauzes, not with non-sterile glove, but you can use gauze to do massage. And before injection, always remove makeup and some jewelry before the treatment. So cleansing, asepsis, and sterile gauzes are very important in all kind of filler injections. Okay, after procedure, post-procedure. We avoid significant movement, sports, or massage of the treated area unless instructed by your doctor. Avoid from exercise for 24 hours, avoid from extensive sun or heat for 72 hours. They all increase swelling and bruising. Avoid consuming excess amount of alcohol and salt to avoid excess swelling. If you have swelling, you may apply some cool compress for on for 15 minutes each hour. We don't need too much this cool compress, but if you need, yes, you can do it. But you have to be careful not to not to have a contamination. Just put a sterile and clean gas, and then just use the cool compress. You have to be careful not to touch the injection site for not to have a contamination. And if there is any pain or discomfort, you can use paracetamol. Try to sleep face up and slightly elevated if you experience swelling in the previous injections. Okay, thank you very much for your attention. This is our website, training.algeness.com. You can easily enter this website. This is for doctors. And you can see so many training materials there, and you can download some applications, photo applications from this website. And this is the mail address of our clinical support department, and this is my personal mail address and WhatsApp telephone number. You can please do not hesitate to contact with me if there is any problem or if there's any questions. Thank you very much for your attention.